Good evening, friends. You are welcome to our tutorials today. As scheduled, we'll be discussing on anatomy and specifically on the gross anatomy of the tongue. So, discussing on the gross anatomy of the tongue. So, to begin, we are going to discuss on the introduction to the gross anatomy of the tongue. So let's start with that. Let's discuss on the introduction to the gross anatomy of the tongue. When you talk about the tongue specifically, the tongue is a muscular organ that is located partly in the oral cavity and partly in the oropharyngeal or partly in the oropharynx. So we can simply put it this way. The tongue is located at the oral cavity partly and the oropharynx partly. After knowing this introduction about the tongue, you need to know also the function of the tongue. The tongue performs many functions. One of the important functions of the tongue is that the tongue helps for articulation. For example, you cannot talk clearly without the tongue. If the tongue of an individual is being removed, the individual cannot talk. You cannot hear the person because you need the tongue for articulation. So one of the functions of the tongue is for articulation. Another function of the tongue is that the tongue is important for mastication. Mastication means chewing. When you are chewing the tongue with your teeth, the tongue pushes the food to the region where you can chew with your teeth. So it's essential for mastication. The tongue is essential for deglutition. Deglutition means swallowing. The tongue is essential for what now? Deglutition. So the tongue therefore performs many functions. But one of them you must mention is that the tongue is important for tastes. So you can taste different type of food because you have the organ known as the tongue. So since we've seen the function of the tongue, the next thing we need to talk about now is the parts of the tongue. The parts of the tongue. How many parts does the tongue have? The tongue has 3 parts specifically. If you look at the diagram on the board, you can observe that this aspect here is called the root of the tongue. This other aspect here is called the body, and this aspect is called the tip. So what are the 3 aspects of the tongue? What are the 3 parts of the tongue? 1, we have the root of the tongue. Secondly, we have the body of the tongue. And lastly, we have the tip of the tongue. So the body of the tongue is the part between the root and the tip. After knowing this aspect known as the parts of the tongue, we need to consider the surface you can see is what we refer to as the dorsal surface. So this is the dorsal surface of the tongue. The dorsal surface of the tongue is also called the superior surface. So it is superior. Then the inferior surface is also known as of the tongue. We said we have the what? The dorsal surface, and we have the ventral surface. The dorsal surface of the tongue is divided by a V-shaped structure. A V-shaped structure which we refer to as the terminal sulcus. So the sulcus is a V-shaped structure that divides the dorsal surface of the tongue into the anterior and the posterior 1/3. I don't know if you get that point. Let me repeat that. The dorsal surface of the tongue, this surface, is divided into V-shaped terminal sulcus. It's called terminal sulcus. V-shaped terminal sulcus. It divides the dorsal surface of the tongue into anterior two-third and the what? And the posterior one-third. The anterior two-third of the tongue is demarcated by a medial septum here, which you can see here. It demarcates these aspects into two. So we've seen the surface of the tongue. We said you have two surfaces, the dorsal surface, also known as the superior surface, and the ventral surface, also known as what? The inferior surface. When you look at this diagram specifically, you are going to observe that there are some structures you can see here. These structures are referred to as papilla. If, for example, you open your tongue, you look at the dorsal surface of the tongue, you'll see that it's not smooth. It has some structures located within it, some structures arising from it that makes it rough. You refer to them as papilla, or in common papillae. These papillae of the tongue can be classified into four. So in the ventral surface of the tongue, and specifically the anterior two-third, you are going to see some papilla. And we refer to this papilla, we said they have four different papilla. So what are the four different papilla that you are going to see in the aspect of the tongue, the anterior two-third of the tongue? We are going to name them one after the other. So pay close attention. The first one we are going to talk about is called the filiform papilla. Filiform papilla, that's one. Number two, we have another called the foliate papilla, or papillae, as some people refer to. Then we also have the fungiform and the circumvallates. We are going to talk about each of them. But let's give a little brief up from the things we're talking about, so I hope you are following us as we are giving up this brief up. We've talked about the introduction of the tongue, where we find out that the tongue is a muscular organ that is located partly in the oral cavity and partly in the oropharynx. We've seen the function of the tongue. We said the tongue is important for mastication, for chewing. It takes food to where you have the teeth. It is important for deglutition, for swallowing. The tongue is important for tasting important structures of food or other substances that we feed on. We've seen the surface of the tongue. We said the tongue has two surfaces. This surface, which you can see here, is called the what? The dorsal surface. The one which is inferior is called the ventral surface. The two surfaces of the tongue, the dorsal surface and the ventral surface. We've also looked at the aspect that this dorsal surface of the tongue, which you can see, is demarcated into two aspects by a V-shaped structure called the terminal sulcus. So terminal sulcus separates the dorsal surface of the tongue into two aspects, the anterior and the posterior one. We said in the anterior two-third, you are going to see some specific structures that makes this anterior two-third not to be smooth. It's not smooth, it's rough. That's why if you bring out your tongue, you see it's not smooth, it's kind of rough. Those structures that are projecting from the anterior two-third that makes it rough are what we refer to as the papillae. We said there are four different papillae that is found in the anterior two-third of the tongue. The first papillae is what we refer to as, we said, we have the filiform papillae, we have the fungiform papillae, we have the foliate papillae, and we have the circumvallate papillae. I hope you can remember the name of this papillae. Please try to remember them. Filiform, fungiform, foliates, and circumvallates. These are the papillae that you see in the anterior aspect, anterior two-third of the tongue. Now, of these papillae that we are talking about, some of them have taste bud, others do not. So let me ask you this in your exam. Give an example of a papilla that has taste bud. Give an example of a papilla that do not have taste bud. Of the 4 papillae I mentioned, one of them do not have taste bud, and that is the filiform papillae. So the filiform papillae do not have taste bud. And take note, the filiform papillae is the most numerous of all the papillae we have. Of all of them we've mentioned, from the 4 we've mentioned, the most numerous is the filiform, but it does not have taste bud. The smallest of all of them, there's very few, is what we refer to as the circumvallate papillae. Circumvallate papillae is very few. It is located close to the sulcus or to the terminal sulcus, very close to the terminal sulcus. That's where you see the circumvallate papillae, which help to taste bitter. So bitter taste can be felt using the circumvallate papillae. Taste buds that are located within the circumvallate papillae are responsible for giving you that bitter taste. So we have different tastes. I hope you can remember the taste we have. We have sweet, we have sour, we have salty, and we also have bitter. Otherwise, they may also tell you have another taste known as umami, but that's not mentioned here. Now, when you talk about these tastes, let's say sweet, what part of the tongue do you feel that sweetness? What part of the tongue is responsible for that sweetness? Is it the anterior part? Is it the posterior part? All right. The anterior part of the tongue, this tip of the tongue specifically, the anterior part, is responsible for tasting sweetness. Responsible for tasting sweetness. The posterior part of the tongue is responsible for tasting bitterness, bitter tastes, and sour tastes can be felt at the posterior aspect of the tongue, whereas the lateral aspect is responsible for salty tastes. So remember that important point. After knowing this, the next aspect we need to talk about is what we refer to as the lymphoid nodules. The lymphoid nodules. If you look at the anterior two-thirds of the ventrals of the dorsal, we said it has papillas or papillae. But in the posterior aspect, you see that there are also some structures located in the posterior one-third. These are not papillae. You refer to them as lymphoid nodules. So lymphoid nodules are the lymphoid structures that makes the posterior one-third of the dorsal surface of the tongue to be rough. These lymphoid nodules, lymphoid, L-Y-N-P-H-O-I-D, nodules, N-O-D-U-L-E-S. These lymphoid nodules that you see at this posterior aspect, together, they are referred to as lingual tonsil. So potentially be asked in the exam, what forms the lingual tonsil? The lingual tonsil are formed by the lymphoid nodules that are located in the posterior one-third of the tongue. After considering this, let's talk about the muscles of the tongue. The muscles of the tongue. The tongue has specifically 8 muscles. But these muscles can be classified into 2 large groups. These are the extrinsic muscles and the intrinsic muscles. So let me ask you, what are the 2 major groups of the muscles of the tongue? 1, the extrinsic muscles. 2, the intrinsic muscles. Intrinsic muscles. The extrinsic muscles are 4 in numbers. The intrinsic muscles are 4 in. Now, what are the 4 extrinsic muscles of the tongue? Number 1, we have a muscle called the genioglossus. Genioglossus. Glossus, genioglossus. Number 2, we have a muscle that is known as the hyoglossus. Hyo, then glossus, hyoglossus. Number 3, we have the muscle known as the styloglossus. And number 4, we have the muscle known as the palatoglossus. So this is a potential question in short test. It asks, list the 4 extrinsic muscles of the tongue: genioglossus, hyoglossus, styloglossus, and palatoglossus. A mnemonym to help you remember this is this: God helps serious people. God stands for genioglossus, help stands for hyoglossus, serious stands for styloglossus, then people stand for palatoglossus. These are the what now? Extrinsic muscles of the tongue. At this point, the extrinsic muscle of the tongue is responsible for changing the movement or the position of tongue. It changes the position of tongue. So I can move my tongue from one place to another, change the position because of the help of the extrinsic muscles. But the intrinsic muscle of the tongue helps you to change the shape of the tongue. So you can change the shape of the tongue using which muscles? The intrinsic. You can change the position of the tongue using the extrinsic muscles. Having understand that point, I will now list the intrinsic muscles that we have. The intrinsic muscles are very simple to remember. We have one, which is referred to as the superior longitudinal muscle. We have another, which we refer to as the inferior longitudinal muscle. We have another, which we refer to as the vertical muscle. And we also have the transverse muscle. Very simple to remember. Very simple to remember. Superior longitudinal, inferior longitudinal muscle, and the transverse muscle. Now, these 8 muscles that you see in the tongue, or the muscles of the tongue, are all supplied or are all innervated by nerve, except one of them. So let me put it this way. All the muscles of the tongue are innervated by a nerve known as the hypoglossal nerve, that is cranial nerve 12. One muscle as the palatoglossus. The palatoglossus is innervated by pharyngeal plexus of vagus nerve. So cranial nerve 10 innervates the palatoglossus. Apart from that muscle known as the palatoglossus, all other muscles of the tongue, both extrinsic and intrinsic, are innervated by the hypoglossa, innervated by the cranial nerve 12. So don't forget that important point. The cranial nerve 12 innervates all the muscles of the tongue except palatoglossus, which is innervated by what? Cranial nerve 10, the vagus nerve. Now, let's now move to what we refer to as the innervation of the tongue. Innervation of the tongue, we are going to talk about the nerve supply to the tongue. Not just the nerve that innervates the muscles, but the nerve that also gives sensory supply, that gives. So let's just talk about the nerves. Let me break it down here. And let me try to break it down here. When you mention that this nerve, you say this nerve that supplies, it supplies the muscles. Generally, people refer to that as motor innervation, when it supplies muscles. And when it supplies the skin of something, it's called sensory innervation. So you can say we have motor innervation to the structure and then sensory innervation to the structure, supplying the muscles, motor innervation, then supplying the skin is called what? Sensory innervation. But with regards to the tongue, there's what we refer to as general sensation and special sensation. So let me break that down. I'm trying to break it down for you. General sensation means, or general innervation means, which nerve helps you to feel the tongue when you touch the tongue. When the temperature of the tongue is increased, what nerve helps to observe that something like that is happening? But when you say special innervation, we are talking about what nerve helps you to taste. So with respect to tasting, it's called special innervation, because tasting is a special sense. You know, you have different special sense, have the ability to taste, to smell, to hear, blah blah blah. So with that, let me now tell you about the innervation to the what now? To the tongue. To understand this, you have to remember the point we mentioned, that the dorsal surface of the tongue is demarcated by what we refer to as the terminal sulcus into the anterior two-third and the posterior one-third. So when talking about the innervation, we are going to talk about the general sense, the nerve that gives general sensation to the anterior two-third, and the nerve that gives special sensation to the anterior two-third. We are also going to talk about the nerve that gives general sensation to the posterior one-third, and the nerve that gives special sensation to the posterior one-third. Remember, general sensation have to do with touch and temperature, whereas special sensation have to do with what now? Special sensation have to do with tastes. So, the anterior two-third of the tongue has general sensation coming from lingual nerve. The lingual nerve is a branch of V3, and V3 means mandibular nerve. And the mandibular nerve is a branch of trigeminal nerve. So put it this way: the anterior two-third of the tongue gets its general sensation from the lingual branch of the mandibular nerve, which is a branch of the trigeminal nerve. I hope you get that point. Let me once more. The anterior two-third of the tongue gets its from the lingual branch of the mandibular nerve, which is a branch of the trigeminal nerve, cranial nerve 5. To know cranial nerves, please watch my video on cranial nerves. I've given it very simple mnemonic there on how to remember the 12 cranial nerves and whether they are sensory or motor. So we talked about the general sensation to the anterior two-third. Let's now talk about the special sensation. What nerve gives that special sensation in the anterior two-third? Special sensation in the anterior is what we refer to as the cauda tympani branch of facial nerve. Cranial nerve 7 is not a facial nerve, and it has a branch called cauda tympani branch. The cauda tympani branch of facial nerve gives innervation to give special innervation to the anterior two-third of the tongue. But take note, though it gives special innervation to the anterior two-third of the tongue, there is something that is not innervated by it. And this is what we refer to as the circumvallate papillae. Remember, I told you that the circumvallate papillae is very close to the V-shaped terminal sulcus. Structures here, the circumvallate papillae, also known as the vallate papillae, and the taste bud between it are not innervated by the caudal tympani branch of facial nerve. So what now innervates it? As we move forward, we'll talk about that. So now let's talk about the posterior one-third of the tongue. The posterior one-third of the tongue gets its general sensation and its special sensation known as the 9. Also, the circumvallate papillae, the anterior two-thirds of the tongue, also gets its special sensation from cranial nerve 9. So glossopharyngeal nerve, the nerve that innervates posterior tongue, both innervation, both special innervation and general innervation, also innervate the circumvallate papillae. So we've seen the innervation of the tongue. Let's now discuss on the vasculature of the tongue. That is, what is the artery that supplies the tongue? What artery supplies the tongue? It is supplied by an artery referred to as the lingual artery. The lingual artery is a branch of what we know as the external. I repeat, the tongue is innervated by the lingual artery, and specifically, the lingual artery is a branch of what? External carotid artery. So we can simply say the external carotid artery innervates the tongue, but that will be in a very large scale. Specifically, if you want to make that clear, you say what innervates the tongue? The lingual artery. But the lingual artery are of different types. We have the deep lingual artery, we have the dorsal lingual artery. Both of them helps in innervating, in supplying the tongue with blood. The veins that drains the tongue are also known as the lingual vein. We have the deep lingual vein, we have the dorsal lingual vein. They assist in draining the tongue. Talking about the lymphatic drainage of the tongue, it's very important to know the lymphatic drainage of the tongue. The lymphatic drainage of the tongue. So just look at the diagram here as I'm going to explain the lymphatic drainage of the tongue. The lymphatic drainage of the tongue is exceptional because the root of the tongue, this aspect here, drains into what we refer to as the superior deep cervical lymph nodes. So I repeat that point. The root of the tongue drains into what we refer to as what? The superior deep cervical lymph node. Next point. If this aspect drains into the superior deep cervical lymph node, where does the central aspect here drains into? The medial part here drains into the inferior deep cervical lymph node. So let me repeat that. The root of the tongue drains into the what? Superior deep cervical lymph node. The middle aspect or the median aspect of the what? Of the anterior aspect of the tongue drains into the inferior deep cervical lymph node. The lateral aspect on the body of the tongue drains into what we refer to as the submandibular lymph node. Submandibular lymph node. And the tip of the tongue drains into the submental, as the apex here drains into the submental lymph node. So we've talked about the drainage now. Please try to remember these aspects. So let me now give you a brief up of what we talked about. This video has lasted for 30 minutes. So let me give you a brief up of what we talked about, giving you the points that may be very needed in exam conditions. In our introduction, we talked about the tongue. We said the tongue is a muscular organ that is located partly in the oral cavity and partly in the oropharynx. So you may be asked in your exam, the tongue is located fully in the oral cavity. That's wrong. It is partly in the oral cavity and partly in the what? In the oropharynx. We talk about the functions of the tongue. Remember, it helps for mastication. It shifts food to the teeth so that it can chew. Number 2, it helps for deglutition. It helps to swallow. Yes, assist in swallowing. Number 3, it helps for tasting. You can taste because you have the tongue. These are some of the functions of the tongue. We talked about the parts of the tongue. We said the tongue has the root, the body, and the tip. The tip is also known as the apex. So people refer to this as the apex. Don't think that's not correct. It's correct. The root, the body, the tip, or the apex. Both of them are correct. Now, we said the surface of the tongue are 2. This one you can see here is called the dorsal surface, and the one inferior is called the ventral surface. We said the dorsal surface is not smooth at all. It is rough, and we talked about what makes it rough. We said the dorsal surface is demarcated by a V-shaped structure, which we refer to as the terminal sulcus. It divides the dorsal surface into the anterior 2/3 and the posterior 1/3. After talking about that, we said the anterior 2/3 is rough because of the papillae that we have. We listed the papillae that we have. The lingual papilla. We talk about the foliform, the foliates, the circumvallates. So let's list them once more. The 4 papillae that we have: foliates, filiform, circumvallates. We said circumvallate is also known as vallates. And we also have foliates. Remember, we've listed the papillae that we have. And we said all of them has taste buds, except which one? Except the what? The filiform. The filiform papillae do not have taste bud. The anterior aspect of the tongue help to taste sweetness. Posterior help to taste bitterness, bitter taste, and sour taste. Lateral aspect help to taste what? Help to taste what we refer to as salty taste. Then we talk about the muscles of the tongue. We said we have 8 muscles in the tongue that can be classified into 2 large groups, which are the extrinsic muscles and the intrinsic muscles. Extrinsic muscles help to change the what? The position. Intrinsic muscles help to change the what? Help to change the shape. We talk about the extrinsic muscles, talk about the intrinsic muscles. We said all the muscles of the tongue are innervated by cranial nerve 12, except palatoglosssus, which is innervated by cranial nerve, what now? Cranial nerve 9. Cranial nerve 10, sorry. That is the vagus nerve. Now, after talking about that, we talked about the vasculature, the lymphatic drainage, and all of that. Try to watch this video continuously so that you can get the brief up. Then you read your textbook and your materials about the tongue. With that, I have to say thank you very much for streaming to this live video, and tell your friends that tutorials are started through this means. They should participate fully. Thank you once more, and God bless you.